So today we're going to show you how to load the syringe to get the syringe ready to get your patient numb. You have your syringe sitting on your tray, you have your cotton pliers, you have your cotton tip applicator, your gauze, your protector needle sheath prop, your needle of choice to use for the injection or injections that you're giving, and your anesthetic. So first what you're going to do is pick up the syringe, make sure that the harpoon looks sharp and that it moves freely within the syringe itself. And then what you're going to do with finger pressure, you're going to hold the syringe and push with your thumb to pull the actual piston back in the barrel of the syringe. You will take the anesthetic, colored side faced toward your hand, push this in first, it falls into place, get the barcode out of the way, and then release the piston. And then with gentle finger pressure, you will engage that sharp harpoon that we originally checked into the back of the plunger. One thing you do not want to do is hold the syringe like this and tap really hard to get that harpoon engaged for fear that you can crack the glass and cut yourself. So that's the assembly of the syringe with the anesthetic. So the next part we're going to go to is the actual assembly of the needle onto the cartridge. And what you want to do is break the seal between the colored end of the needle and this clear plastic end. And you want to hold on to this and keep it on your tray and not throw it away, because we're going to be using it for something different later on with the injection. What you'll want to do is, when getting ready to gently place the needle at the end of the syringe, you can see that I have a fulcrum. And that's stabilizing my hand, so that way I'm not free holding and potentially hitting the adapting end of the syringe into the needle. I'm actually stabilizing, so it's easier for me to actually engage the needle onto the syringe itself. This is a self-threading needle, so I can continue to rotate it down on the syringe adaptation end of the needle, and it doesn't stop, as you can see. So the threads are being made as I'm turning it. And then what you do is take this protector needle sheath prop and you push this on to the edge of the stop of the cap of the needle. And this protector needle sheath prop protects you, the operator, when you are recapping your needle at the end of the procedure. And then what we do to check the needle and the flow of the anesthetic, gently hold the syringe in your hand, pick up your cotton pliers, and this will be in your non-dominant hand you're holding the syringe. In your dominant hand you'll be holding the cotton pliers. Place it on the red part cap of the needle, and you are gently going to rock the cap off. And you can twist and rock back and forth to break the seal, and gently let the cap drop onto the tray itself. And then what I'm looking for is the flow of the anesthetic, making sure that the harpoon is engaged. Sometimes with a quick assembly, and if you're not watching what you're doing, students will put the cartridge of anesthetic in backwards. And when you go to depress the plunger with the harpoon, there will be no anesthetic that comes out. So it's better to find this out now before going in and actually trying to give an injection and there's no anesthetic that's being delivered. So with that said, I see that there's a good flow of anesthetic. At the end of the needle, you will see that it is slanted. And in this case, it is slanted up towards me. Every needle has a bevel. The bevel means that it's an angle at the end of the needle. And with every injection, we need to be really cautious that the bevel is always facing up towards the bone or towards the bone in each injection, which makes for more of a comfortable injection. And we will talk about this more in lecture. So let's say our bevel is already assembled or already oriented in the way that we need to go ahead and give the injection. What I am going to do is, you always use a one-handed method when you are recapping the needle. If you find that this protector needle sheath slides around your tray, with your opposite non-dominant hand and a barrier between your hand and the protector needle sheath, you can hold for stability the cotton pliers and then recap the needle nice and tight. When you go to lay the needle down and prepare it for the actual delivery of anesthetic, you see that your tray is much more narrow this way and of course much more wide this way. So to prevent the cap of the needle with the protector needle sheath from falling off and rolling off the tray, we don't place this syringe this way, short ways. We place this syringe long ways. And we always place the syringe with the big window of the syringe facing down and the small window of the syringe facing up. It's important when doing an injection that when you pick the syringe up, and of course the needle cap will be off, that we pick it up and the big window is facing up towards the operator. That allows the operator to see if upon aspirations, and we will talk about aspirations more in lecture, if there's any blood that comes into the cartridge, how we need to manage that blood inside the cartridge. Something that is a little different when placing your tray onto your bracket table. Your bracket table will not be alongside the patient's chair. It'll actually be behind the patient's chair. So let's go ahead and bring this over. And as you can see, the syringe is not facing the operator. I would be an operator on the right side of the chair. So I would then pick my syringe up, face this towards me, and it would be ready to go. One last thing that I would always check is to make sure that the cap is just loose enough that all that needs to happen is when I'm ready to pick the syringe up, the protector needle sheath prop and the cap falls off in the opposite direction of the syringe itself. I told you to save this clear part of the cap and this little Q-tip swab. We're going to walk back over here. Your topical anesthetic is never to be placed on the tray. If topical anesthetic is placed on the tray, the whole topical jar needs to be thrown away. So this is going to be kept in your non-contaminated area, so usually under your view box. You are going to take just a little swab of anesthetic, topical anesthetic, in order to keep the anesthetic from getting all over the tray and the gauze and the syringe. You're going to put it in the clear cap that you saved from the needle. You're going to place this right next to the syringe, recap your topical anesthetic, and put that back on the counter. And one important thing that I did not mention is you see I'm doing all my assembly with my patient gloves on. I don't do it with bare hands, and of course I do not do it with utility gloves. Just briefly, if I am ready to give the injection, you will see that the cap will slide off, and sometimes it does need a little bit of extra help. So you saw the cap and the protector needle sheath fall the opposite direction. I would then bring my hand up, I would come around the patient's body, and sometimes I will tell students to rest their hand on their thigh. We will talk more about that in lecture. Recapping the needle, it's very good practice to make sure that your non-dominant hand does not want to come and help hold the protector needle sheath prop while recapping the needle. It's the JC protocol, the SRJC protocol, that we pick up the cotton pliers and only utilize them if in fact we are having difficulties recapping the needle. And I'm going to show you what difficulties might be. Maybe this protector needle sheath prop is moving across the tray, so the cotton pliers will be a barrier between my hand, the protector needle sheath prop, and the syringe, holding the protector needle sheath prop with those cotton pliers, and then securing the end of the needle within that cap. And then I place the cotton pliers down. So for the disassembly of the syringe, I've changed my gloves. I'm now in my utility gloves. This is a contaminated equipment. And what you want to start with is, the first thing that you start with is the needle. And you're going to take your cotton pliers, come to the white part of the needle, and as you're holding the white part of the needle, you're going to be turning this syringe. And what this does is this unthreads the needle. You're going to place the needle with the protector needle sheath down. Your little carrier that was holding on to your cotton tip applicator with the topical, you are going to take off and recap the end of this needle so it's secure. As you can see, I'm doing everything with my cotton pliers, and that is secure there. Put your cotton pliers down. You're going to pick up the syringe like we did in the beginning. I'm going to pull back on the thumb ring to release the harpoon from the cartridge, and I will do it the exact same way that I do when I was loading it. I will then pull the cartridge out. There's the cartridge on the tray. There's the syringe. So disassembly is just the reverse of assembly. You start with the needle first, recap it, make it safe, and go to the disassembly of the syringe.